Well, first, thank you for the warm welcome. It's the first time I think that I see my ancestors with me when I speak, and it's quite emotional, I think. It's also gripping to be here, having worked with this business of green economy and cities and public policies, with people who have generated some of the evidence which makes a difference at the global level. So it's an enormous pleasure to be here with Philippa and with all of you. And the fact that we have benefited from a lot of what you've done here, it's part of the reason to come and to be with you. When you are starting this important step that is already built in a lot of what you've done, but I do feel very strongly which the leadership that is required to change things at the local level, but also the global level, is the kind of thing that you have to praise and you have to come and be with. So I'm pleased to be here and with my ancestors as well. I'll talk a bit of some of my own perspective in working globally, the kinds of things that we see, and how is it that we can engage with people like you, and we have engaged and do engage, in bringing some of these global policy changes, or in helping to bring that along. And I do think that, and I'll stress that, it is leadership and individuals make an enormous difference. We have thousands of studies in air pollution, and I've been talking about that with some of you. Most of them look at the links, what are the health disbenefits, what are the health problems caused by air pollution. Only 10 have looked at what are the results of interventions. And I think it makes those 10 are very valuable. And we should be focusing on doing more of that kind of work. And I think this is something that when we were doing the green economy analysis for housing that we found in New Zealand, that the follow-up study that looked at insulation and looked at what actually happened and why people did it and what were the benefits and who benefited and who didn't. Those kinds of questions, first of all, and that kind of rigor in conducting the analysis to answer the questions are unique, and that's the kind of things that we can use. That's the currency that we have in global public health terms. So I'll start by painting some of the problems, because I think they are so complex that it makes it for, and I think the first one is, just give you a bit of context where we are, the kinds of things which are in my mind when I'm here, and certainly in your mind. And the first is non-communicable diseases, that we have a total of 2/3 of all the world's deaths are caused by non-communicable diseases. And that's also in developing countries. And even in African countries, you have half the mortality by non-communicable diseases. And that's where some of the increases are going to be largest. This costs a fortune to development, to individuals, to families, in terms that it does reach a wide range of people, as you can imagine. We're also, and the health sector has moved ahead in the debate with determinants of health, especially with social determinants. There's now quite a lot of concern and interest and talk and discourse about social determinants of health. But still, I sense from the environmental health perspective that there's a disconnect in what our concern with social determinants and our ability to act on those and to respond. And a lot of the responses are in environmental health, are on the physical environment that we have, and we haven't yet made that connection. Some of our internal silos, I think, in the health sector are relevant from that perspective. And we even ignore or tend to ignore some of the evidence on cost-benefit analysis, or where we do have a lot of evidence for interventions on environment. And we're happy to invest on immunization at $27 savings per dollar spent, but are not doing the same kinds of things or letting pain, or perhaps water and sanitation we are, but in sustainable inactive transport, for example, some of the studies show quite potentially quite good result. And we haven't yet made those links as we could. We've talked about climate change, and I want you all are familiar with that, but there's such a wide range of issues which are touched by climate change in health, and making that connection in terms of water quality and quantity, food security, risks of infectious diseases, disaster resilience, heat waves. And we do know a lot about the inequality, and this is the WHO analysis, who causes climate change. What has been caused is mostly the North, and who's suffering the results today are mostly in the South. The other issue is urbanization, and I'm going through very quickly because we're familiar with this, but just to paint a bit of the picture of the breadth of the issues that we're seeing. And I think the final issue that I'll raise is actually the importance of economics. And this is investments from the US in developing countries. So you see that USAID is the red thing there, official development assistance from the US into developing countries is comparatively very small if you look at private investment and foreign direct investment. And this is just development banks and multilateral regional development banks. And they do have a very big influence on what monies get used in developing countries. And I don't think those things are immaterial in the way, and that partly justifies why we're here talking, and why the green economy focus, and why we're talking in terms of sectors of the economy. Because this is where the investments are permeated through, and this is how we organize ourselves in terms of providing a response and trying to change policy in the direction of protecting and promoting public health. And these are the main areas of investment for regional development banks: transport, energy, telecoms, water. So I'll pass now to the green economy. And I've already justified why we're going for the economy. And I do think it is the economy stupid who does a lot of the movement of interest of people, means jobs, etc. And so within that perspective, we decided in WHO, and there was a growing discourse in OECD, a mainstream discourse, if you want, on green economy. And we thought we should do some analysis to see how health relates to that. As a public health agency, that was part of our job. In trying to look at what were the green economy policies which were being proposed, it was very difficult to put your hands on. But it was easy to put your hands on what was being proposed for climate change mitigation, because there's the IPCC, fortunately, who has discussed this, who put together the panel, who won a Nobel Prize, and who put together formulated some proposals. So we thought it was a valuable effort to look at that, partly to contribute to the IPCC and to climate change discussions, but also to react a bit and to reflect on what was being proposed in the name of a green economy. So what we've done was to look at what IPCC was arguing or proposing in terms of mitigation policies for different sectors of the economy, because that's also how it is organized. And to reflect on, and to look at the knowledge, the evidence base, for which of those policies have benefits to public health, and which ones may not have benefits or have disbenefits, or which ones were neutral. The overall aim was to identify what was synergistic. I mean, people have a number of options to take if you're investing your monies at the local level or at national level. I mean, where is it that you have the best results for your efforts? And admittedly, the IPCC was looking at CO2. What policies reduce CO2? They were not looking at co-benefits. They were not looking broadly. Fortunately, the Lancet and the public health community had already started discussing this and created in the Lancet papers, you have some very good analysis and case studies and examples. Now, we decided to use some of that understanding and to apply systematically around a series of policies which were being proposed. And we thought that as an intergovernmental agency we were about, it was the right thing for us to do. So we know overall that smart development policies can reduce pollution, injury, etc., and improve health. But it's not necessarily that any environmentally friendly policy will necessarily help health. And so we set out to put some, and I'll give you some of the examples of what we found out. The first one that I'll put is healthcare. It's not part of the IPCC. It hasn't, I mean, normally healthcare is excluded from carbon, commitments. But we thought as we're a health sector, we would, do a bit of due diligence and look at our buildings, transportation, the way that we do our business and what is required to do our business, and do some analysis. And I think the examples that we were talking with Anna, I don't know if she's here, this morning about what you're doing in the good opportunities for Christchurch are also in the health sector. The way you build your hospitals, the energy savings, the public transport access, the waste management. There's a package of things which are, and they also have, they relate to carbon and to the carbon footprint. This is a good reflection because it's led for WHO to engage more with NGOs, with other people, with the UK government, who's doing lots of things to do with carbon in procurement of medicines and medical technologies, for example. So it led to reflection, the new program that we're starting to develop around it's not only the climate footprint, but what is it that the health sector can do to protect public health through the environment and protect the environment. And there's some. We also found that there's lots of waste, perhaps in rich countries and in big hospitals, even in poor countries. There's also in Uganda, for example, 58% of the clinics and the hospitals, the healthcare facilities, have no access to electricity, and depend on, candles or sort of torches. So it's quite staggering, and that wasn't in the public domain. So it set us in a good course. That is just being published now because we were so. I have an investigative journalist who works with me in some of the writing. And we ended up tracking some of these questions and trying to find, so it ended up leading to a lot of new questions, which I think it was a good result. The second one is more familiar to everyone in this room, is about green urban transport. And what we saw that the IPCC was doing, there was a lot of focus on technologies. Fuels, and like most governments do to address air pollution issues, for example, or injuries. But there was, and even diesel was being promoted as a good thing to reduce CO2. Now, diesel, we all know, is a carcinogen. It produces loads of particles. This is very bad news. So we thought, well, that's important that we raise that. I mean, there's relatively little effort in non-motorized transit, non-motorized transport and transit systems, which we do know have not only good benefits for CO2, but also have co-benefits for injury prevention, physical activity. We know that, but it wasn't in that as part of that discussion. And even the result of follow-up studies of good quality, like the 30% reduction in overall mortality found in Copenhagen and in Shanghai, in very good studies for non-motorized transport. There was no connection between these two debates. And this is also done by a New Zealander, in fact, who helped in this project, Jamie Hoskins, who's in Auckland. And what he's done, I mean, and we've done this for all of thank you, Philippa, that's very nice of you. We've done in all of the reports, in all of the analysis, but we actually to do a review of the literature, not around what we know about public health, but what are the policies that the other sector is proposing. In this case, by the IPCC, and that you find in your left column. And see how much those policies have impacts on physical activity, on injury prevention, on obesity reduction, or reduction on cardiovascular disease. And to our surprise, you have two columns there. On the left, it is the positive, the fact that those sustainable development package of transportation policies, sustainable transport policies, the positive impacts on health. And on the right column are the negative impacts on health. So some studies show negative impacts. But most of the studies document that there's a benefit of what we call sustainable transport, which is a package of walking, cycling, and rapid transit. So just putting the evidence together in that way, for us, it was quite enlightening to see that we perhaps haven't used so much, and we should be doing more. We should be doing systematic reviews, and we should be making much more of the evidence that already exists. The third example is on housing. And again, a focus on technological solutions, a large overlook of slum housing, for example, housing of the poor, the inequity issues were not in the first rank of concerns. And it is in our concerns because of health equity issues. And for example, things missed like natural ventilation, which is, or a lot of praise for, and I have lots of slides on this, but I won't go there. But praise for air conditioning, which of course it can be helpful in the situation of extreme weather events, but you have a number of, there's infectious diseases which are transmitted, you're creating more climate change. There's a number of issues which are raised by that. And this is what we've done. We looked at the categories that IPCC had created in terms of the proposals. We look at the health, the environmental risks, the disease risks, and the health equity issues, and that's what we've done for our report. And then we came up with a number of suggestions or recommendations, from starting not to use asbestos in construction to, the range of use of natural ventilation, dealing with radon, and we put the evidence together. So I won't stop there. I'll probably stop only in green areas, occupational health issues, which was raised this morning as part of the package, as hazardous materials. And this is the follow-up studies, which were few and far between, but very good. So we were very happy to find the studies of Wellington and the New Zealand evidence. And that made a lot of difference for the kinds of recommendations that we could build for thermal insulation, which was one of the big recommendations of the report. So overall, we found that the smart growth ideas have not or had not merged into the IPCC discourse, possibly because they were so focused on the CO2 reduction story. And then it leads into technological solutions, etc. And you end up missing a very big part of the picture, which for a city, for example, would be much more beneficial. You could engage more of the population and more of the politicians in finding collaborative solutions. So that was the Green Economy series. And having done that, and we're still publishing the last reports, the agriculture one is still about to be published, the energy one is about to be published, in the healthcare sector. But what we faced last year in preparation for the new sustainable development, post-2015 sustainable development debate, is that the Rio +20 debates didn't have a word about health in the basic document, which was distributed in January 2012. So we were surprised and unpleasantly surprised and worried. And so we took what they were considering. They were considering those 7 themes there: energy, water, food, cities, jobs, oceans, and disaster management. So what we've done, and that's the kind of thing that we do with evidence, we engage with scientists, and some of you have contributed to that, globally, and saying, well, what are the health indicators that we could be proposing for those areas if they were successful? And we rapidly produced. So the blue document is the Green Economy series cover. The red one is the health indicators for sustainable development goals. So what we've done was to quickly put together some 3 health indicators for each of those areas, and a logic and some rationale behind it, and some of the data sources that could be used. And we've been using that around the debates. You know that the debates are happening now. There's some, so we're using that documentation, which is an expert panel. I mean, it's not a systematic review, but it brings some of the main points together. And I'll give you some examples. For sustainable cities, one of the proposals was just to use air quality guidelines levels, which are well known for many people, cities do measure air quality. And there's a very clear health link and a very clear link with inefficient use of energy. So both in terms of transportation and housing and land use. We also used for energy households in developing countries which have no access to clean fuels. There's a major cause of ill health, or short-acting climate pollutants, of deforestation, of violence against women, of children, of girls not going to school because they have to cook for hours. There's a long list of very well-known public health issues associated with that. The technologies should be more developed, and yet, that's still not completely incorporated in the public domain. So I won't go into the detail of that because I don't want us to spend too much time. These are some of the other examples, and these are the cities developments. And there are some indicators we try to do with how much access people have to rapid transit and cycling and walking. And it can be as percentage of the road or the public thoroughfare space, or it can be a distance from your home, for example. I'll skip that, and I'll go to my main point then that I'd like to make, and I'll wrap that up. In how is it that we use evidence, and the power that we in the health sector and as scientists have in bringing that evidence together in ways that address the policy relevant questions. So is not only having the science, but is asking the right question and being brave enough to ask the right question. That includes where these health risks are coming from, who is it affecting, who's benefiting on this benefit, and what can we do about it, and where's the evidence for the interventions. So I think this is very crucial, very central to the development, sustainable development debates that we have today. And this is some of our main contributions. And I'll venture a bit and provide some examples of, there are some governance mechanisms, and we discussed this in these mornings and these afternoons, but mostly in the morning. What are the governance mechanisms that exist? How is that we can engage with this evidence? And some, we sit in the health sector, but we're very close to environment. And there's a number of things which are used by environmentalists that we haven't yet tapped enough. And I'll give you some examples. One of them is just what the environmental movement and what civil society has done with some health evidence, including in terms of creating some examples for litigation. The National Defense Resource Council in the US has made history, I think, in terms of environmental movement in the US by bringing together scientists and lawyers in a few good high visibility cases. I'm not, as WHO, advocating that you should be taking people, but I think it's a relevant example of how health is used, if the evidence is there, can be used and is used by, for advocacy purposes, including through legal mechanisms. Because there is law, and there are tort cases, and there's liability. These things are part of society mechanisms to provide justice. So access to environmental justice, I think, is one of the ways that we can use health information if it is packaged and covers the right questions. Just air pollution and health. Everybody knows that air pollution is better health. And that came out of a few studies initially. And this is the 6 city studies, the first follow-up study, which provided some of the evidence, which I think made an enormous difference about how I understand this. The way we engage with this in WHO is transformed into guidelines. It just provides a rigor in terms of systematic reviews, et cetera, and having the kinds of transparency mechanisms to make our recommendations, a weighing of the evidence. And I'm very happy to let you know that we're doing this with housing now. For us is a major, and thanks to part you work, Philippa is our chair, And that's part of the reason why I'm here. I think it will make a very big difference. The fact that people can be, there's a benchmark. People naturally will compare, the cities will compare themselves around, are they arriving at the WHO air quality guidelines or not? Are they protecting people in the way that the WHO guidelines propose? I think the same can happen with housing. And in the future, it could happen with transport and with other public policies. Economics, I think, is very important that we are able to count externalities and document. I don't think it's the only thing, but it does. There's a number of policy debates which happen in a utilitarian way and with utilitarian arguments, and we should be prepared to engage with those and have the responses. A lot of it is how we talk with the other sectors. And that's just saying what is the debate and what are the concerns in transportation of the transport people, the environment people, and the health people in the 3 columns. And there are some things, some elements of the debate which are common. Others are not. So the knowledge about what is the concern of another sector, transportation is congestion. I mean, that's, for me, number 1 in terms of what concerns they have. Normally, we in public health don't worry about congestion. If anything, it reduces speed, it reduces, maybe increases a bit of air pollution, but it reduces injuries, so, overall can allow for more people to cycle. For us, it's not an issue. But it's important to understand what other people are thinking. And you do have in your project the issue of how you're going to address perceptions and how people are going to engage and different people are going to engage. The costs and benefits I'm transforming into tools. This is HIT for cycling or HIT for walking. The fact that we have that ability to do those tools, I think, is very crucial for public health. And just the fact that we can have the narrative that talks about the connection between the policy, the risk in the environment, or the risk to health and the health outcome. I mean, those narratives are very important. And the way that we can package them. This is the European Environmental Agency, which has done for transport a line of reasoning that makes the connection between the whole chain of events. And this is what we've been doing with water and sanitation, where we're now, this WHO does this, we monitor how much money countries, how much investment is going into water and sanitation, what policies are being enacted, how many of those policies are being implemented and enforced, and what are the results in terms of water quality. That sequence of events, for me, produces accountability over where is public effort going, where are the investments going, what are the actual changes in health risk, and what are the changes in health impact. And I wish that we would be moving into this kind of accountability mechanism. This is just to say that in big projects, the banks do have some mechanisms, the financial institutions have some mechanisms, and we've been engaging with them in terms of making better use. This is the banks call them safeguards. And that's because they're fearful of risks of their investments. Now, we should also be fearful of the risks and we should be watchful of the benefits. That's what we want to do. And so I'll complete saying that what the health sector can have and what the health sector or yourselves have shown in New Zealand is leadership. Leadership in science, in terms of addressing the right questions, because in terms of providing the answers. And I'll finish with that, because I think that's the essential role that we have in the tools that we have nobody else does. The kinds of evidence and the detail of evidence and rigor in terms of scientific. If you compare economic studies, and we do respect for economists and economics, with econometrics and epidemiology, I mean, when I did econometrics, having being an epidemiologist already, I realized that, we're very fussy in public health. And I think that's a good reason for us. And we're probably very respected. I'm not saying that more respected than economists. Probably they have more of a clout than we do sometimes. But we do have some essential tools that if we use it for public policy making, for health and health equity, I think that's the best we can do. And leadership is, I think, the name of the game in terms of using the right science, putting the right questions, and addressing the right audiences. So I thank you for your attention and for your patience in staying to this.
Thank you very much, Carlos, for I was talking to Carlos before and saying that many times in New Zealand, because we're an island, we have a very random series of countries that we compare ourselves to. And it's really good to have that overview and that kind of vision, which I think is largely driven by you, and we really appreciate the fact that you've flown from Geneva to be here for this meeting and then going to fly to Australia and back again. Given that it's 5 o'clock for Carlos, we've got time for a couple of questions before we break. If anybody would like to comment, ask a question.
Thank you, Carlos, for that very interesting address. So my question is about how we frame the green economy and sustainable development. In this country, I think there's been quite an interesting shift in the last decade from a focus on the sustainable development of the country to economic growth. And there's also been a move on the part of some to emphasize the green economy. Can you just take us through why that green economy emphasis is so important internationally, and has it replaced sustainable development, or is it a new version of sustainable development?
Ralph, I think you can respond that better than I can, but in any case, I'll have a go. I think it's, you go to the OECD, and that's where the green economy is being, sort of basically the mantra of the environment department of OECD. In our OECD itself, I mean, the 50 years of OECD, that was the main. And so I think that has taken looking at environmentalism as an economic issue, as being green technologies, green development. It has taken a very big role in the international debates. UNEP's group on green economy is going a bit more sustainable development. There are some more connections, but still are run by economists. Now, the discussion with the Maori discussion before, and I was just asking after the discussion because I missed a part of it, it was very interesting because the issues to do with spirituality or with where do I belong, what am I doing this, it seemed to have lost a bit of space in this economic focus of, and in fact, I was debating with myself when we started this to call this a green economy or not. The reason for calling it a green economy, because I think we have to have different interpretations of that. And what does that mean? I mean, what is a green economy? What should it be? And I think that's still not completely resolved. I do think that is still ongoing. And I think the opportunity now is the sustainable development debates. And that's where I think we should be raising some of these issues. However, I must say that wherever I've been engaging, transportation, the sustainable development goals, energy, cities, the sustainable development, the real development issues are not so much reflected. I think the green economy has made a lot of the space in terms of debate. That's my impression.